Welcome to the Health on Track podcast. Let's talk well-being.
Welcome to the Health on Track podcast, offering you a shot of wellness. My name is Noor. I'm the Regional Health and Wellbeing Manager at GIG Gulf. Today, we are talking about autoimmune diseases, though they may not be very common, but they're very serious. Therefore, understanding what triggers them and how we can protect ourselves for them is very important. Joining us today, Dr. Bhavna, Consultant Rheumatologist at HBG Medical Centre in Dubai. With over 20 years of experience, she has been a lead rheumatologist in UAE and has been the member of expert groups in establishing DHA rheumatoid arthritis management guidelines. Dr. Bhavna, thank you so much for taking time and being with us today.
Thank you so much, Noor, and thank you for inviting me, and it's a pleasure, and I look forward to the discussion today.
So to start, let's start by explaining what is rheumatology and its link to autoimmune diseases.
Very good question, because not many people are aware of rheumatology as a specialty. So rheumatology is a branch of medicine that deals with common rheumatic diseases or rheumatological conditions. Mm-hmm. Now, these can be simple wear and tear related arthritis, age-related arthritis, but we also look after people who have autoimmune disorders, also known as autoimmune rheumatic disorders. So we cover a wide range of medical conditions. In other words, the common ones are musculoskeletal, joint and bone related problems, but also we deal with autoimmune conditions that may affect other parts of the body and not necessarily just the joints.
Correct. Doctor, can we know what are the types of autoimmune diseases and which are the most common ones?
Yeah, so autoimmune conditions can virtually affect any part of the body. It's not necessarily just joints. Yeah. So depending on which organ or which part of the body is affected, you can get autoimmune disorder of that particular system. For example, the most common ones are the autoimmune conditions that affect bone and joints. And that's why the autoimmune rheumatic disorders, for instance, the common one is rheumatoid arthritis, you must have heard of.
Yes, of course.
This is an autoimmune condition that can affect joints, causing inflammation. And if not treated early, it can cause joint damage and disability and deformities of the joints. And that is the most common one. Yeah. There are other autoimmune conditions, for instance, an autoimmune condition that commonly affects thyroid, also known as autoimmune thyroiditis, is a very common condition. And this is basically causing inflammation of the thyroid gland, which eventually affects the function of the gland and hence the hormonal problems. So there are a number of autoimmune conditions, and it depends on which organ is affected.
Okay. And can you give us maybe some statistics on how many people are diagnosed with autoimmune disease?
So, that's a very interesting question, because I think the problem here is underdiagnosis of many conditions. So there are many people who have autoimmune conditions and they may not necessarily get diagnosed. Hence, it is very difficult to get the exact incidence and prevalence of autoimmune conditions. Roughly, autoimmune rheumatic diseases affect 1% of the world population. And this is only an estimate because there are many people with milder forms of autoimmune rheumatic diseases. They may not necessarily be diagnosed and they may live all their life without knowing the diagnosis.
So would you say there is an increase in number of people diagnosed? And if yes, why do you think the reason behind it?
Again, a very interesting question, because there is definitely a rise in autoimmune diseases in the last decade. Now, this could be simply because of lifestyle and various stress and many lifestyle factors that can actually lead to the true increase in autoimmune disorders, or simply because there is increase in awareness. There are better methods to diagnose these conditions. So we are diagnosing more people compared to the diagnosis in the past. So it could be either of these or combination of these factors. There seems to be an increase in the incidence of autoimmune rheumatic diseases, autoimmune diseases in general.
So, Doctor, we had this chat before the episode about one of my family. They got diagnosed last year, and from there we started to read more about what is the autoimmune disease, what is sarcoid. It was sarcoid. It's one of the diseases under the autoimmune disease. And I was shocked to know that there are many triggers that can trigger that disease, not specifically sarcoid, can be stress, can be food, can be maybe medication, vaccines. So from your perspective, doctor, what do you think the triggers for autoimmune diseases?
So autoimmune disorders in general are known to be seen or commonly occur in people who have a genetic risk. Okay. So in other words, a person may be born with the risk of developing an autoimmune condition, but they may not necessarily develop it until a certain period in time in their life. So a genetic background or a genetic risk in a person, when this person comes in contact with a risk or a trigger, your autoimmune disorder can start manifesting with symptoms. So in other words, a person with a genetic risk, when exposed to certain triggers, your immune system, which is there to defend your body, may start becoming hostile and become overreactive. And it may start attacking your own body parts or body organs or body structures.
And what are these factors? Can be
So the triggers can be various, particularly diet. They could be dietary triggers, and there could be infectious triggers are the most common ones. So typically, a serious infection or even a simple viral infection like a flu or a sore throat, which triggers your immune system just naturally to fight the virus. Eventually, the immune system may not necessarily come back to its resting stage and continue to be overreactive. But there is no enemy to fight because the virus or the bacteria has been already, killed by the immune system. But your immune cells do not go back to resting stage, and they can start, attacking your body parts. So infections are the most common triggers.
Okay.
And as we mentioned, stress can be, by far we see a lot of times patients when they manifest for the first time, they are going through an extreme stressful period in their life. And also pregnancy in women. Pregnancy can be a state of stress where there are a lot of hormonal changes that are happening. So many young women develop autoimmune rheumatic disease such as rheumatoid arthritis, either during or soon after the childbirth. It's either because of physical stress or hormonal changes or emotional changes as well, because it's a very delicate period of a woman's life. So there are virtually many triggers, and diet, as we said, over the decades, we've seen change in the way the food is manufactured, stored, and supplied. We see a lot of people developing autoimmune disorders in response to certain type of food we consume. Some of them are well studied, some of them are still not very well studied.
This is the issue.
That's the problem.
There are many triggers, there are many new diseases under the autoimmune disease umbrella, and anyone can have it, right? So what do you think maybe the symptoms that we need to look out for to determine these things?
So again, as I said, it's the part of the body or the organ of your body which is affected. Now, typical, as I said, is rheumatoid arthritis, and people can start experiencing joint pain. And not necessarily old people. It can be young people. Children can get autoimmune rheumatic diseases such as rheumatoid arthritis. The most common symptom in rheumatoid arthritis, for example, is stiffness in the joints, multiple joints, typically small joints of the hands, feet, and they can get swollen, they can get inflamed. And typically they're first thing in the morning. When you wake up after not using your joints all night, in the morning, they wake up with stiffness in the fingers, stiffness in the feet, even the wrists, shoulders. So these are the joint inflammation-related direct symptoms. But there can be other indirect symptoms like extreme fatigue. I mean, of course, 90% of people in the world are fatigued now because of various factors. So we're not necessarily saying that fatigue is the only symptom. But in addition to your joint symptoms, you may just experience extreme fatigue. You can get skin rashes. Some rheumatic diseases can have rashes that are triggered by sunlight, like lupus, for example. You may start getting rash on your face, which is triggered by sunlight exposure. A lot of dryness in the eyes, dryness in the mouth. And again, you can't take individual symptom. These are cluster of symptoms we're talking about. So it depends on which organ is affected. Your symptoms can manifest that way. And many a times, these symptoms can be very slowly progressive, and hence you may not necessarily seek medical advice. And even sometimes the doctors you consult may not suspect an autoimmune condition because they start investigating you for the common conditions. And it's only when the common conditions are not diagnosed and you have persistent symptoms, you may then get diagnosed because they start looking into other possible causes of your symptoms.
So I think, doctor, it's not easy for the patients to know that symptoms and reaction to medications is vary from one patient to another, and each case is different. And it's crucial, I think, for the autoimmune patient to keep symptoms stable and under control. And that's why it's important for individuals, they need to speak up to share these symptoms with their healthcare professionals so they can find or determine the optimum solution for their treatment plan.
Correct, yeah.
Because sometimes I think symptoms are more annoying than the disease itself, right?
That's true.
So tackling the treatment plan, can we know more on the options of the treatment plan and if there is any permanent cure for these diseases?
Yeah, sure. I mean, with the autoimmune diseases, one should be aware that these are chronic conditions, which means once you have an autoimmune condition, there's no permanent cure, simply because these conditions are as a result of overactive immune system. And your immune system is needed in your body. So we can't eradicate your immune system. So you have to live with your immune system. Hence, there is no cure. But with all the modern advances in the treatments of autoimmune rheumatic diseases, we can actually control the disease and we can put the autoimmune disease to sleep. And that is what we call as remission. So we can achieve remission, we can control the symptoms, and a person can live a perfectly normal, healthy life. However, it's important to know that these conditions can have ups and downs, what we call as waxing and waning picture. So a long-term monitoring of your disease activity is the most important thing. Because quite often people get diagnosed, people get started on treatment, they feel better, they get into remission, they stop seeing the doctors and abruptly stop all the medication.
It will be more aggressive.
Exactly. Now, the general concept of autoimmune treatment, autoimmune diseases treatment, it can be divided into two different sections. One is treat the disease symptoms and the underlying cause using medication or pharmacological treatment. So typically there is inflammation, so you can use anti-inflammatory medication. Often we use a very short course of steroids to put the inflammation down very quickly, because these medicines work very quickly. But the management of long-term control of an autoimmune disease is by using certain medicines known as disease-modifying agents. In rheumatoid arthritis, these are also known as DMARDs. These are the medicines, these are not painkillers, these are not anti-inflammatories. They basically control your immune system and put your immune system under control so that there is no overactivity. Okay. This is called the pharmacological treatment. Now, clearly, pharmacological treatment alone is not enough. It's not adequate, because you've got to take these medicines many a times long-term, or some people may need it lifelong. However, the lifestyle measures are extremely important. This is what determines whether a person can come off medication or reduce the dose or stay on a very minimal medication required to keep the remission in the long-term control. So these lifestyle measures, the most important one, smoking is considered to be the major risk factor for autoimmune diseases. And there is no treatment that is complete without stopping smoking.
Especially if it's affecting the lung.
Absolutely. And it also, smoking contains nicotine, which secretes, which eventually releases oxygen-free radicals, which is a trigger for your immune system. So it's like, you've got the fire lit and you're trying to put water, but the fire has to be put down, right? So smoking is one of the major risk factors. Lack of exercise. Most of the autoimmune rheumatic diseases, people think my joints are inflamed, I can't exercise, I can't move. It's actually the opposite. When you are inactive, the inflammation builds up. The more active you are, the inflammation comes down. So obviously you need to control an inflamed joint, and then you start with the very low impact exercise. Minimum 30 minutes of some form of exercise on a daily basis is mandatory. Diet, very important. And as we discussed earlier, there are so many dietary triggers.
I'm surprised because many doctors primarily focus is on treating these kind of diseases is through medication. They neglect the significant role of mental health or the life adjustment, as you just mentioned. So if you can talk more about it, I think it's a good element to cover in this session.
Absolutely. And as I mentioned earlier, these are the factors that can determine if a person is going to need more and more medication long-term medication, or high doses of medication based on the lifestyle adjustments. So as I said, smoking, stress management. Everybody is stressed in the current times, but you have to have some form of stress releasing mechanisms. Now, whether it is in the form of keeping a fixed time for yourself where you're going to leave everything and just focus on your mental health and things that you enjoy, listening to music. So there are various things that you can do, spending more quality time with your family. Very simple things, but we often ignore that. These are very, very important.
And doctor, do you provide these things in your clinic as well?
Yeah, sure. I mean, it's a very interesting that when patients come to see us for the first time with symptoms suggestive of autoimmune rheumatic disease, the first visit is always history taking and examination, doing some blood tests. But the second visit when I see a patient is all about explaining the disease, medication, etc. I do not usually mix them in one consultation because you can't really focus on everything. Quite often, it's very overwhelming for patients. In one visit, you tell about the diagnosis, you tell about the medication, you tell about everything. They cannot retain many things. So I actually do a very specific consultation dedicated just for lifestyle, management.
This is amazing.
It's so very important. And we often see that people who adhere to these lifestyle changes are the ones who can actually get into remission. And it's not just the medication or the doctor. So the credit is not only given to the doctor, but
also the commitment
given to the patient. So it's all about co-management, as you rightly said. It's contribution from the doctor and the patient equally. So involving the patient in the management of long-term conditions, autoimmune conditions is absolutely vital. And this cannot be achieved without educating the patient right at the beginning of the diagnosis. So that's very, very important.
This is exactly, we're on the same page. I feel today that it's very important to educate the patients and maybe emphasize more on how to keep track of the ongoing research, especially for the autoimmune disease, because still we don't know a lot about it. And maybe by having these ongoing research, they can deepen more understanding of how they can control their conditions.
And as I mentioned to you in our conversation earlier, HBG Medical Center take pride in putting patients first and educating them and allowing them to take control of their own condition. So throughout the year, we have several patient education programs. The largest event we conduct is in collaboration with Middle East Arthritis Foundation. Once every year in October, the first weekend, we have a huge event where we spend the whole day with our patients. We nearly have about 200, 300 patients attending this with their family members. We have something for educating them for lifestyle measures. We also have something known as Circle of Care. So we get people to sit together and share experiences, and a doctor or a healthcare professional sits with them. So this is the largest event we have. But throughout the year, we have small group meetings. For instance, in the month of February, we are having weekly meetings in the Al Jalila auditorium, where the first session was all about mental health and stress management by a health coach. The next Saturday, we have a yoga session. So a yoga instructor will come and talk to you about how yoga can help manage long-term conditions, autoimmune conditions. People often think we have bad arthritis, we can't do yoga, but there are different forms of yoga. And he's particularly been with us and educating patients about simple yogas like chair yoga.
This is amazing. You're just only giving them the advice, you're giving them the tools so they can start using it, which is great.
And we have one whole dedicated session on food for arthritis or diet and nutrition in rheumatic diseases. And that is the most attended session. So we have these sessions throughout the year because sometimes in a clinical consultation, we cannot give so much time for going into the details of everything. And hence we have these, these are completely free, and patients and their family can attend.
And this is only for rheumatoid arthritis, or you're planning to open it for others?
So, again, as I said, we cover pretty much all autoimmune rheumatic diseases, and they're not necessarily affecting just the joints. So there are people who have sarcoidosis, for example, and they attend because the root cause is the same. The root cause of all autoimmune conditions is overactive immune system. They may have different targets. Your immune system may may attack either eyes or intestines or joints, but the root cause is the same. So the treatment strategy is the same for all autoimmune conditions. You have pharmacological management, you have lifestyle management. And these lifestyle management factors are common for all autoimmune conditions. So clearly, everybody can benefit by attending these sessions.
Thank you so much, Doctor.
Yeah, thank you.
If there is a piece of advice that you would like to share, what would it be?
So I think one thing is, again, emphasizing lifestyle. And number two, early diagnosis. So many a times people often ignore their symptoms. It's very important to be aware of your symptoms and ask for help and get an early diagnosis, number one. For people who have an established or diagnosed autoimmune condition, my biggest advice is not to ignore. Just because you're in remission, you have no symptoms, do not stop your medication without your doctor's advice. And monitoring is important. Monitoring of your disease activity is important, but also monitoring your medication is important. So adhere to your treatment and keep attending your regular follow-ups. That's very, very important.
Thank you so much, Dr. Bhavna, for your time today and for all the effort to raise the public awareness. Stay tuned for our upcoming session about children's mental health. We will be available on YouTube, Spotify, Apple Podcasts, and Anghami. Until then, please stay healthy and take care. Thank you.